is Kim Speeder from 10 Sigma. Welcome to episode 72 of Transition Tuesday. Today I will be discussing educational practices for helping and teaching children who have suffered from trauma. Right now I'm going to switch over to a short slide presentation to share this important information.
Trauma-informed practices in special education. In this video, I will discuss the definition and sources of childhood trauma, the effects trauma can have on children, and suggestions for evaluations, team meetings, and the IEP. The National Child Traumatic Stress Network defines trauma as occurring when a child experiences an intense event that threatens or causes harm to his or her emotional and physical well-being. Some sources of trauma may include result of exposure to a natural disaster, events such as war and terrorism, witnessing or being the victim of violence, serious injury, or physical or sexual abuse, accidents or medical procedures. Sadly, about 1 in 4 children will experience a traumatic event before the age of 16. Some physiological effects of trauma, which are normal reactions, fight, flight, or freeze, include increased heart rate, sweating, feelings of agitation, hyper-alertness, gastrointestinal distress, and emotional upset. The psychological effects of trauma last much longer and interfere with physical and emotional health. So there is a development of reactions that persist and interfere with the student's daily life, the student functioning, and their interaction with other people after the traumatic events have ended. This may include intense and ongoing emotional upset, depressive symptoms, anxiety, behavioral changes, difficulties with attention, academic difficulties, nightmares, physical symptoms such as difficulty sleeping and eating, and aches and pains, among others. When handling information about the child's traumatic experience or experiences, remember, confidentiality is critical. Imagine the worst thing that you've ever experienced. How many people do you want to know about it? Keep this in mind as you receive and share information about the trauma a child has experienced. Respect the child's story. Don't ask for more information than what is needed. Just accept that you may not know all the details. And do not ask the child to retell the story or talk about the trauma. This can re-traumatize them. This type of work should be done by mental health professionals. If the child begins to talk about what happened, listen, be supportive, and remind the child that they are safe. Remain calm and neutral. Possibly ahead of time, discuss the scenario with mental health professionals and follow their suggestions. And remember, you may need to report things that you hear. Next, let's look at some suggested evaluations that could be used for students who have been traumatized. This could be either for initial evaluations or re-evaluations. The Federation for Children with Special Needs suggests the following: a psychological evaluation. It's helpful to refer a traumatized child, or one who is suspected as such, to a mental health professional, preferably with a PhD, who has knowledge about the impact of trauma on academic and non-academic progress. To protect the confidentiality of the student and his family, the details of the trauma are far less important to a school than the understanding of how the child is functioning and why this is so. Trauma triggers, specific ways to help the student modulate emotional and physical responses, ways to make the student feel safe and secure at school, and specific modifications and/or accommodations should be included in the evaluation report. Another suggested evaluation is speech and language. An appropriate evaluation should include linguistic, pragmatic, and narrative aspects of language. Many children with complex childhood trauma are challenged by receptive and expressive language delays, age-appropriate perspective taking, and social cues. Other suggested evaluations include a functional behavioral assessment. Specific behavioral challenges require specific behavior plans to ensure academic and non-academic success. An FBA consists of collecting information about the antecedents and consequences to the student of certain environmental or internally driven challenges, like trauma triggers, distorted image of authority figures, and an inability to follow routines and rules. Therefore, there must be a careful assessment of the school and classroom environments. And occupational therapy evaluations. In addition to developmental delays in fine motor skills that may be evident with a traumatized child, accommodations and modifications that will produce a calm and nurturing learning environment can be recommended through these evaluations. The next thing I want to cover are some tips for IEP team meetings. First, approach team meetings with the following understandings. The student is complex and their needs are extensive. The student has experienced a situation or situations so violent and extreme it impacts them all day, every day, in all areas of functioning. Many people may be involved. Remain child-centered and focus on their strengths. Consider their exposure to violence in addressing discipline issues. These meetings will take time. Remember, meetings are about developing support systems for the child, not doing what is easiest for adults. Lastly, let's discuss some suggestions for writing IEPs. To help the child become more resilient, focus on the following 4 domains. The first one is relationships. Oftentimes, the child does not know the basics of relationships. They may avoid relationships, so they need to develop skills with peers and adults. The second domain is self-regulation. Children who have been traumatized are often in a constant state of hyper-arousal. They don't know how to put the brakes on. They see the world as unsafe. They're always ready to react, which is different from impulsivity. Dysregulation must be addressed before academic achievement can occur. Because of the chemical flooding in the brain, based on a traumatic experience, it is literally impossible for a child to learn until regulation occurs. Remember, you cannot teach algebra to someone who is running from a bear. The third domain is physical health and safety. Consider developing a child-centered safety plan. For example, if a child runs out of the room when upset, develop a route for him or her to run to safely. Chasing and yelling at them will only recreate trauma. Let the child choose a safe place for him or herself in the school. Monitor them, but let them get to a physically safe place and calm down before beginning an intervention. Let the child identify safe, go-to people who can be called on to help with behaviors. Avoid restraints or hands-on procedures. Include specialists to help with sensory issues. Things like smells and scents can be powerful triggers to a child who has been traumatized. And the fourth domain, academic success. Students who have been traumatized may have unusual academic gaps from periods of dysregulation. Create realistic, achievable academic goals. Baselines can always be raised, and IEPs can be amended as the student achieves. Celebrate small successes and gains. Use concrete data to show a student their progress, which helps to build trust. A final thought for today's video is an excerpt from the book The Boy Who Was Raised as a Dog and Other Stories from a Child Psychiatrist's Notebook: What Traumatized Children Can Teach Us About Loss, Love, and Healing, written by Bruce D. Perry. The most traumatic aspects of all disasters involve the shattering of human connections, and this is especially true for children. Being harmed by the people who were supposed to love you, being abandoned by them, being robbed of the one-on-one relationships that allow you to feel safe and valued and become humane. These are profound destructive experiences. Because humans are inescapably social beings, the worst catastrophes that can befall us inevitably involve relational loss. As a result, recovery from trauma and neglect is also all about relationships, rebuilding trust, regaining confidence, returning to a sense of security, and connecting to love. Of course, medications can help relieve symptoms, and talking to a therapist can be incredibly useful, but healing and recovery are impossible, even with the best medications and therapy in the world, without lasting, caring connections to others. For today's bonus, I'll be sending you links to information and resources for teaching children who have experienced trauma.
Thank you for watching the video. I hope you use this information to help your students who have suffered from trauma. Be sure to check your email for the bonus we just sent over. If this is the first time you've ever seen an episode of Transition Tuesday, click the link below to receive the bonus. Be sure to like and share the video and leave a comment or suggestion for a future episode of Transition Tuesday. Have a great week. See you next Tuesday.